Hi, I am Bria Bowie, the founder and CEO of Myel. So Dr. Leverone has actually been my doctor for almost 5 years now and has helped me so much. So I couldn't keep her a secret from all of you.
Mm.
Dr. Leverone is a California licensed naturopathic doctor specializing in hormone balancing and bioidentical hormone replacement therapy. She's received her pre-med degree from the University of California, San Diego, and her doctor of naturopathic medicine from Bastyr University in Seattle, Washington. She completed a 2-year residency program focused on functional medicine and hormone replacement therapy. She also teaches hormone therapy to other practitioners and lectures throughout San Diego to educate the public on how hormones impact their health. Dr. Leverone is also an expert in genetics and nutrigenomics, which means she can provide personalized treatments tailored to each patient's genes. She leads a genetic case review monthly with other practitioners as well. And, at Myel, we believe education first, and we spend a lot of time speaking about how light can help the problems. But in order to fully educate women and for us to really understand our bodies and our intimate health, we really need to evaluate the root or causes of these issues. So, hi, Brooke, how are you?
Hi, Rishi. I'm so good. Thanks for having me today. I'm excited.
Yes, me too. We want our customers to really get at the root of the problem and the causes of all the issues that they're experiencing. They come to us,
Yeah.
and want the Myel to fix an issue, but there's an all-encompassing health problem that we need to address. So that's what you're going to help us do today.
Yeah. Yeah.
So, childbirth, let's start there. It's a big one. That can alter like a woman's health significantly, right?
Yeah.
Causing pelvic
Absolutely.
floor issues, vaginal laxity, but also a huge shift in our hormones as well. So, could you explain a little bit about what happens to our hormones, like during pregnancy, and what we can do to support ourselves during and after baby?
Yeah. So there's a lot of different things that can happen with your hormones during pregnancy. We have estrogen and we have different types of estrogens. We also have progesterone, which is the gestation or pregnancy hormone. These are kind of the big players in terms of our fertility and able to get pregnant and hold the pregnancy. And these hormones will shift roles a little bit when we're pregnant, and we'll get different types of estrogens and we'll get lots of progesterone. The other piece of that picture is that our reproductive hormones don't act independently, meaning they're connected to the adrenal hormones, which are connected to the thyroid hormones, and the thyroid hormones are connected to the reproductive hormones. So while your reproductive hormones are shifting in pregnancy, so are all of these other hormones. And when you think about it, the fact that a woman is growing another human being inside of her and then bringing it into the world, there is a lot that goes into making that happen. And at the end of the day, what we find is that most women, after delivering the baby, there's a big drop in your hormones because you've sort of given them all away, if you will. So I find that the stress that takes place just on the system during that period of time results in a lot of times lower hormones in certain areas afterwards that need to be supported. There's a lot, it all depends on the patient. So there's a lot of different things after pregnancy. Women often will find that their cycles change, sometimes for the better, sometimes for the worst. And it all depends on exactly how their body is reacting to the situation. But the most important thing that I find, well, there's a lot of important things. Diet, lifestyle, exercise definitely are going to be your first thing to be focused on. But I always try and support my female patients nutritively with supplements for the adrenal glands. There's only so many things you can take when you're pregnant. So it does limit what we can take supplement wise. That's why the diet, lifestyle, exercise is going to be so important. But I always want to provide my patients with support for the adrenal glands and its role in the hormone balance with herbs that we know are safe through pregnancy and then after.
And then with the adrenals, does it, because obviously it supports so much and you can drain your adrenals by being overextended. So, I mean, as a
Yeah.
new mom, right, you're totally overextending.
Yes. So that's the big issue that I find is that after baby one, and then especially after baby two, that the female's adrenal glands, and the adrenal glands are the hormones that help us manage stress every day. They're, what gets us up in the morning, deals with traffic, deals with deadlines, deals with getting the kids to school on time, etc. So the adrenals do, and they also deal with internal stressors. So if your blood sugar is too low and you're hungry, or if you're fighting an infection, the adrenals also have to do with that as well too. So after pregnancy, I find that they get taxed and you're just depleted in some of your hormones in being able to manage those changes every day, being able to manage those stressors every day. So we want to definitely support those adrenal hormones with herbs that are, of course, safe in pregnancy, and then especially afterwards, getting you back on your feet again.
Definitely. Alrighty, that's okay. We're gonna shift gears a little bit here and go to menopause. So,
Mhm.
a lot of our customers are dealing with menopausal issues, but what exactly is happening in our body during perimenopause, menopause, postmenopause? Like, what's the difference with all of that, and what's going on?
Yeah. So menopause is the natural process where your ovaries stop producing estradiol, your primary estrogen. We also decline in progesterone and testosterone. So we're moving out of our reproductive years into our later years, which, 100 years ago, that was pretty much our life expectancy anyway, and things ended at that point, regardless. We obviously live in a much different time, so it's having an even greater impact on our health nowadays. So when you are there's a bit of a nomenclature issue around menopause. It can get confusing. So the period of time leading up to and around actual menopause is called perimenopause. So peri means surrounding. Now, the interesting thing is that perimenopause can technically last for up to 10 years. Now, with menopause being between 45 and 55, that means you can be in perimenopause as early as 35. So a lot of women we see will start to complain in their late 30s, early 40s, something just doesn't feel right, something is off. During the perimenopause, the engine, if you will, that makes the estradiol is starting to kind of get a little worn down. Things are slowing down. The body responds by urging that ovary to keep producing estrogen. It's like wringing out the ovary for every last drop of estrogen we can get. And as a result, we tend to be high in estrogen, leading to perimenopause. So, very common for heavier periods, more frequent periods, painful periods, breast tenderness, um, weight gain, low libido, moodiness, and irritability. All that can start to happen with some of those changes. Now, that's all into perimenopause. Then we have menopause, which the nomenclature is a little weird. So, menopause is technically 12 consecutive months with no period. Once you hit month 13, you are now post menopause. But you don't know if you're in menopause until you've hit 12 months. And then you're like, oh, that was menopause. And now I'm post menopause. So that's why there can be some confusion around the terms. So that's why we usually say women, oh, well, if you start missing periods and it's been a few months, maybe you're in full menopause. Blood tests can help us confirm that. We often just say perimenopause. And then once it's been month 13, you're now considered postmenopause. And then what happens is the reason your periods stop is because now the engine that makes the estrogen has now dropped. And so now we don't have any estrogen to keep us vital, to feed that vaginal tissue, to keep it moist and healthy. We start to get forgetful. We get hot flashes and night sweats and more weight gain and more, all these fun things that happen. So that's what happens when we lose our estrogen. Post-menopause, it starts to get a little bit better, but women sometimes continue to deal with issues like hot flashes and night sweats because of those lack of hormones, as well as issues with vaginal health. That's also a huge component of menopause.
Right, right. I mean, there's so many components in menopause that we, are just so unaware of, and they happen to us, and we, our customers feel like they're alone. And so, that's
Yeah,
part of it, and educating, right? So,
yeah, exactly. And so many of my patients will be like, when we do labs and we talk about what's going on, they finally feel validated and, oh my God, I'm not crazy. Like there is something going on, because unfortunately, female hormones are not addressed well at all in traditional medicine. And there's lots of reasons behind that. But the fact is, if you don't have a blanket disease, a blanket hormone disorder that needs to be highly medicated or surgically treated, then you're considered normal. And most women are told, this is aging. You just kind of have to deal with it. Here's a Prozac to make you feel better about the situation.
Right,
And
right.
that's not what's going on. The hormones have become imbalanced. And while you're not diseased or dying, you don't feel good and things aren't functioning optimal. And it doesn't have to be that way. You can, and you're not crazy and you're not alone. This is happening to all of us. Understanding what's going on and then knowing what your options are to be able to manage it, knowing that there are options to be able to manage it is so important. Why I love doing things like this with you, because we need to let women know that there are ways to help support these changes so you don't have to just suffer through it, and know that this is a normal part of the transition that can be more treated better than it's currently being managed in modern medicine.
Yeah, absolutely. I mean, I'm a huge advocate for biohacking, really like taking charge of your own health. I talk about it a lot when I get interviewed because we want to be able to feel better, and it's okay to want to feel better and look outside the box a little bit. And I really want to provide that platform for women in all aspects of their life, not just okay, here's the wand, do this, but
Right.
there's a lot of stuff. What be educated on what's going on first,
Yeah.
so then you can take the steps forward.
Yes. Yeah.
So one of the issues that, it happens during menopause is vaginal dryness. Like it can be a big problem for women. So what causes vaginal dryness exactly?
Yeah, so it is directly related to the lack of estrogen.
Okay.
So estrogen has hundreds of functions in the body. It's not just making your breasts swell every month and causing your uterus to line so that you can have a baby. It feeds bones and brain and cardiac and muscle, but it also feeds not just the breast tissue when it swells, but it feeds that vaginal tissue. It keeps the vaginal tissue plump and moist. When we then lose our estrogen, that declines. Those tissues are no longer being fed and they start to become thinner and drier as a result, which can be extremely painful. Women will commonly come to me saying it feels like there's knives or glass in their vaginal tissue when they're having sex, which is, I mean, that's not fun or the point, right? And again, a lot of women don't know that they don't have to suffer with this. So some of the challenges is I find that women kind of just deal with it and put some coconut oil and think that this is just life now. But if it goes too long, you can actually get severe degradation of that tissue where you're getting scarring and which means if once you get the scarring, it's just a more severe version of the dryness, which is more painful and harder to come back from. If you treat it early and get on top of it early, it's much easier to manage. And some cases from the beginning are more difficult than others. That some women can get it earlier in life than from menopause because of unique variances in just their own hormones. But commonly, it's a menopausal issue because of the decline in estrogen, and that can vary from woman to woman on the level of severity and what works and what doesn't work in managing treatment. But typically you can use vitamin E is one of the best things you can use if you're just going to use a natural over-the-counter product. Vitamin E feeds connective tissue. That's why it's important and different than like just a coconut oil. And then from there, we also use estrogen. Estrogen feeds the tissue, so it puts it right back into place. And then, of course, there's cases where there's going to be other issues going on, and we need other interventions and other things that can, help them depending on the situation.
So, and then, I mean, with there's the tightness, and that's sort of what the red light does too. It also, it basically regenerates the cell back to its original state and helps with the dryness. But that's a good tip with the vitamin E. That could be a good marriage for sure. I like that. If
Oh, yeah.
someone's interested in going to the route of the have like expensive creams that are prescribed now,
Right. Yeah.
right? If
Yeah.
it's pricey.
Yeah.
So
Vitamin
another,
E is cheap. It can
sorry.
work.
Yes. So another issue that our customers deal with is a vaginal bacteria, and I
Yeah.
think this is a topic that's extremely confusing for most women. So could you explain bacteria and how it's tied to our hormones? Because sometimes we have customers that say yes they have BV or bacterial vaginosis, and then other times it's just they just don't know what's causing it.
Right. So we are not a sterile being. We do have bacteria that lives on our skin, in our gut, in our nasal passages, and in our vaginal tissue. This is what we call our microbiome. This is a whole set of thousands and thousands of different bacteria that make up our microbiome and work symbiotically with us to keep us healthy and functioning well. The vaginal tissue is part of the microbiome and where that healthy bacteria lives. And like other areas in our body, this healthy microbiome helps protect us from infection. It also helps with metabolizing the hormones. If we have too high of estrogen, so during that perimenopause period, when we become estrogen dominant, there's other reasons we can become estrogen dominant. Estrogen dominant can actually cause overgrowth of some bacteria, which can then be a bad thing. So now you've got too much bacteria. So with the healthy microbiome, it is important that we have a balance. It's always the Goldilocks rule in the body. You don't want too much, you don't want too little. So we have to have a healthy microbiome balance, which includes, healthy gut, healthy probiotics, healthy hormone balance, healthy diet. All of that ties into healthy pH balance. If you have a poor diet and you're inflamed and you're more acidic, that's going to throw off the pH and affect that microbiome balance. Too high of estrogen is also going to throw off that healthy balance of the microbiome. Also, again, too many, too little. In menopause, with the decline in estrogen, you're getting degradation of that tissue, which then also affects the microbiome balance and makes us more susceptible to infections. So the microbiome is a key component to vaginal health for various reasons and can be altered by gut health, diet, and hormone health as well too during different phases of our life, depending on what's going on, whether it's a too high phase or a too low phase.
Right. And I think that's where, you've been, for me personally, been very supportive, because as you get older, it's not something, I think women they go to the doctor, they want to fix the problem, that's it, right? But it's as women with hormones, it's an ongoing thing that we have to manage and balance, and it requires constant care and tending to blood work, checking your hormones, all of that, because you're going to phase into a new phase like perimenopause or whatever.
Right. And I think it's important, with the education, that women understand how to start paying attention. What is working for them? What isn't working for them? What feels good? What doesn't feel good? Tracking your cycles, tracking your vaginal health. Because the more that you understand about what's going on, the more that you're paying attention to what's going on, then the more aware you're going to be when something's not right. And you're going to know when something's not right. And that intuition is really important. Even as a practitioner, I want you to tell me what you feel is going on, because that's just as valuable of a data point for me as anything that comes back on a lab test. Because if you are understanding your body and knowing your body, like, no, I know, like, this is how it was, and now this happened, and now I'm having these symptoms, and I think it's from X, Y, and Z. Trust your instincts. You know what's going on. Trust your instincts. Let that guide you. If something doesn't feel right, go chat with somebody, go talk with somebody, because understanding all of those pieces is what can empower you to take advantage of your health. So I do think it's important, for us to keep educating each other on all of these things.
Absolutely. Well, I mean, with that kind of leads to my next thing, because you work closely with epigenetics.
Yes.
So, and I know I've done all of that with you, all my genetic testing, and it changed my life. But what is genetic testing, and how can it help with our vaginal health or vaginal wellness?
Yeah. So there's different areas of genetic testing. There's like the entertainment genetic testing, we like to call it, where it's like, ooh, where are your ancestors from, and what likely eye color are you supposed to have, and all these kinds of fun things. There's also genetic testing for cancer therapies and types of cancers. There's genetic testing for disease screening, so when we have children and we test for certain disease conditions. There's also genetic testing for drug therapy, understanding which medications you're going to metabolize more effectively. And the area that I look at with genetic testing is what we call nutrigenomics, which has to do with how your body is processing vitamins, minerals, and proteins on a day-to-day basis, and how that is impacting day-to-day function, which means detoxification, hormone balancing, moods and energy, digestion, wound healing, and cardiovascular and neurological health. So it's kind of our day-to-day metabolic programming and how that's working or not working based on your genetics is the area that I look at. So what this does for me is it helps me understand, how is this woman actually processing her hormones? Why are these levels too high? Why are these levels too low? I have cases where I see a patient, they come in with a classic set of symptoms. I'm like, oh, well, this works for that. I'm every time. And I have the patient on the protocol and she has the complete opposite reaction. And so if you're somebody who's like, I feel like nothing works for me, everything's always backwards, that's always my clue is something in those processes of metabolism aren't working right. There's probably genetic variant. So it's been able to really help me with patients who have more complicated cases, who, nothing's seeming to work for them. And this comes into play a lot for me in terms of hormonal health, which we know affects our vaginal health, healthy hormone metabolism, which is affecting our vaginal health. It also helps with detoxification, understanding a patient's detox pathways and how they're processing or how their digestive system is working or not working, which can affect the microbiome, which can affect vaginal health. If they have good wound healing and tissue healing, which is going to affect the integrity of the tissues, which will affect vaginal health. So that's some of the ways that I am able to utilize the genetics in terms of managing my patient care and really helping them achieve their wellness goals, especially in those cases that are a little bit more difficult.
Yeah, and people don't realize, that how complicated it can be, and you shouldn't stop looking. That's one thing I've learned.
Yeah.
With you is, don't give up because the first set of, treatments or
Yes.
things that you did
Yeah.
didn't work, because it definitely is a trial and error, and you will get there.
Yes.
Just pay attention again, like you had said, pay attention to how your body feels and,
Mhm.
what you want for yourself. And it's not wrong to want to feel great and feel
Right.
optimal,
Yeah.
most of the time, right?
Yes.
So, I mean, at Myel, we believe, in a well-rounded health. So, women taking care of themselves in all aspects of life, like we had said. But in your expertise, is there specific suggestions you have for our customers that can support them with their vaginal health? Like, sort of, what would be your takeaway tips?
Yeah. So, um, there's so many. The one thing I would say is start tracking your vaginal health. If you aren't already, be mindful of if there's certain times of the month where you're more moist, where you're more dry, if the type of discharge is changing from day to day during the cycle, if you are noticing different odor changes during the cycle, if you're having infections, are they coming with your cycle? So all these things, start kind of tracking your vaginal health, because that's going to give you some data to be aware of, to understand a little bit more about what's happening. And with that, I would pay attention to your diet, because your diet does affect that. And, eating high sugar foods or eating foods that maybe you're sensitive to and you don't realize that are causing unwanted inflammation. And the things that, this has to do with just sort of tracking and paying attention. But the active things you can do now, taking a probiotic, like honestly, an oral probiotic doesn't just affect the gut, it affects the whole microbiome, which includes your vaginal health. Making sure that you are doing proper hygiene with sex. So always getting up and washing yourself after sex. And urinating. I think that sometimes we miss that memo in our culture, and it's so easy, so easy just to fall asleep afterwards. But you really want to actually just get up and wash yourself, because that'll help with the microbiome balance as well too. So I'd say that those are, the probiotics, watching, being mindful of what you're eating, being mindful of how your vaginal health is changing. Good hygiene after sex is also really important as well too. Front to back wiping.
Oh yeah, that's actually a topic that's come up that we've written some information on, because we didn't realize, like, our customer, they weren't getting the results they wanted, and we're like, that's weird, but they were wiping back to front.
Back to front.
And so, and I mean, these are older women, like, and they've been doing that their entire life.
Yeah.
So,
Yeah. And if nobody, if nobody told you, then how would you know? Like, that's a lot easier than, reaching around. So
yeah, yeah,
yeah,
exactly.
definitely though, you have to come from the other angle, front to back wiping and not back to front, because, and then when you think about it, because you don't think about it either, when you think about it, when you have your anal tissue right there and you're going from that side of the perineum up into the vaginal tissue, you're taking bacteria you may not want in your vaginal tissue with it. So front to back to make sure that you're keeping things going in the out direction.
Direction. Yeah, definitely. Well, there's all kinds of topics that we've got to talk about in order to get this education out there. And
Right, exactly.
you know,
Exactly.
so and you've helped me so much, and I'm so thankful that you were able to take the time and answer some questions
Oh,
for our
pleasure.
customers. So if anyone would like to find Dr. Leverone's information, it will be on our professionals page, and it will go straight to her website. She does do treatments through Zoom, so no matter where you are, you can have the luxury of having her help you as well, as much as she's helped me.
Hmm.
So thank you so much.
Thank you so much. It was so good to see you today. This was fun.
Yes, take care.
All right, you too. Bye.